Hi guys, welcome back to my channel. My name is Ziad, Crohn's disease patient, NHS worker and educator, here bringing you IBD facts and taboo breaking chats. Don't forget to like, comment, share and subscribe on my channel. So let's get started. Hello and welcome to this lesson on the types of surgery that are used in IBD. Now, to give you an overview of what we're going to look at why surgery is needed before looking at the different types of surgery that can be done if you have IBD. So why would surgery be needed? So surgery can be needed in many different situations, and that can include emergency situations, either your medications haven't been working, or you've been on medications for a long time and having a lot of side effects. To help avoid the use of using medications that can prevent the growth and development of children, or nutritional therapy may not be working, or you may have some of the complications such as strictures, abscesses, fistulas, or even colon cancer that may not be responding to medication. So let's look at Strictoplasty. So when inflammation occurs in the intestine, it causes damage. The body will naturally try and heal itself, and in doing so will replace the damaged area with scar tissue. In IBD, intestinal damage due to inflammation occurs continuously, and so does this repair process. This means scar tissue is always replacing the damaged tissue, which can build up over time, causing the affected area to become thick and decrease the size of the diameter of the intestine. This is known as a stricture. Now, a strictoplasty is an operation that widens the stricture without the need to remove the intestine itself. It is commonly needed in those with Crohn's disease. It's important to correct any strictures that occur, as the space available for digested food to pass through is smaller than before, and this can lead to blockages in the intestine. These blockages are known as bowel obstructions and can cause symptoms such as pain, vomiting, severe cramping, and constipation. It also increases the risk of bowel rupturing or bowel perforations occurring, which can be life-threatening. How is it done? Well, medical imaging is first carried out beforehand to identify where the location of the stricture is. And then you will be going to surgery where an incision will be made in the abdomen to allow the surgeons to gain access to the intestines. The portion of the intestine where the stricture is located will then be identified, and then an incision will be made in the area where the stricture is located, making a new opening in the intestine, which is then folded and sewn back together. This makes the area slightly shorter than before, but no intestinal tissue is lost. Now let's look at bowel resections. Bowel resections involve removing a portion of the intestines before joining the two healthy portions either side of the removed part together. This joining is known as anastomosis. And there are different types of resections that you can have. An ileocecal resection is the removal of a portion of the last part of the small intestine and the joining between the small and large intestine, known as the cecum. In segmental small bowel resections, this is the removal of parts of the small intestine. Whereas in large bowel resections, this is removal of either all or parts of the large intestine and can be sometimes referred to as colectomy. When we look at ileocecal resections, they are most commonly done in Crohn's disease, as this procedure may be required when medication used to treat inflammation in the terminal ileum is not working and the inflammation has caused severe damage to the intestine. Inflammation in the intestine also increases the risk of strictures occurring, and so this operation can be done if strictures appear in the terminal ileum. In segmental small bowel resections, this procedure is recommended in those with Crohn's disease as well as those who suffer with strictures, and the strictoplasty is not an option or if large portions of their intestine is damaged due to the inflammation. The amount of intestine that will be removed will depend on the location, severity of inflammation, and the extent of damage the inflammation has caused. With a large bowel resection, this procedure can be done when there is severe intestinal damage in the large intestine due to inflammation or strictures occurring, which can lead to bowel obstructions. Now, depending on how much of the large intestine is affected will depend on what type of colectomy will be done. How are these procedures done? Similar to strictoplasties, medical imaging will be carried out beforehand to identify the location and extent of the inflammation. And then bowel resections can be done in one of two ways. One technique is called laparoscopically, or better known as keyhole surgery. This is where a small incision will be made in the abdomen to allow the surgeon to insert a camera and surgical equipment. The cameras will help guide the surgeon on removing the affected intestines and allow them to join the two healthy sides together. The other method is open surgery, and this is where an incision is made in the abdomen to allow the surgeon to gain access to the entire abdomen. The affected portions of the intestine will be identified and removed before the healthy portions are joined together, but this procedure is more invasive than keyhole surgery. And now we're going to look at the different types of stomas or ostomies that can be created with IBD. So a stoma is also known as an ostomy, and it is a surgical method used to create an opening in the abdominal wall to allow a portion of the intestine to come through, allowing it to excrete waste products into a bag. Now this bag is known as a stoma bag and is fitted around the opening to collect the waste products, and stomas are classified based on the segment of bowel that is brought out to the outer surface of the body. So stomas can either be temporary, which is where the stoma is created to give the bowel which is not connected to the stoma time to heal before the stoma is removed and the bowel reattached to itself. Or they can be permanent, where this is usually where there's a permanent loss of the bowel which is not possible to be reserved, resulting in stoma that is created to be permanent. There can be several different reasons as to why a stoma would be needed, which can include IBD complications such as perforations, obstructions, strictures, or abscesses and fistulas are not responding to medication. Other reasons can include to allow the bowel some time to heal, or stoma surgery can be offered as an alternative to ileopouch anal anastomosis or IPAA surgery for those with ulcerative colitis. The reasons will vary between individuals as to why they would need a stoma, and will also depend on the location, severity, and extent of damage to the intestines caused by inflammation. As mentioned, there are different types of stomas that can be created. So an ileostomy involves removal of either all or portion of the large intestine and creates an opening in the abdomen, usually on the right-hand side, to allow a portion of the small intestine to pass through. With a colostomy, this involves the removal of a portion of the large intestine and creating an opening in the abdomen, usually on the left-hand side. With a total proctolectomy, this is the removal of the colon, rectum, and anus, and involves the creation of an ileostomy to allow the body to remove waste products. A colectomy with ileostomy is the removal of most or all of the colon and involves creating a stoma. And an IPAA surgery is also known as a J-pouch surgery, and this type of surgery eliminates the need for a colostomy to be created because it connects the small intestine to the anus by creating a pouch that replaces the function of the rectum. Next, we're going to look at abscesses. So we've already covered what an abscess is in the previous lessons, and there are two types of procedures that can be done to help treat abscesses. The first one is a percutaneous abscess draining. This procedure involves having medical imaging such as CT, ultrasound, or fluoroscopy to identify where the abscess is located. Once it has been identified, the same medical imaging technique that was used to identify it can be used to help guide a thin needle into the abscess. This allows a sample of the fluid to be obtained to send to the laboratory to check for any infection. At the same time, a small drainage catheter is inserted into the abscess to drain the remaining fluid. This type of procedure will only be done for abscesses that are near the surface of the body. The other operation is an open abscess draining. This procedure is used for abscesses that are deep within the body and unable to be accessed and treated by a percutaneous draining method. It involves surgeons to carry out an operation in the area of the abscess to gain access to it and then drain it. One of the complications with the abscesses is that it can increase the risk of fistulas, of which there are certain type of procedures that can be done for them. So we've already looked at what a fistula is in previous lessons, so let's have a look at the types of surgeries that are involved. You can have an endorectal advancement flap procedure, which is a technique used for complex or recurrent fistulas that affect the sphincter muscles of the rectum. It involves identifying where within the rectum the fistula opens before being cut out. Then the lining of the rectum is then used as a cover by pulling over the area where the fistula used to be. Fibrin glue can also be used with fistulas, and it's a procedure that involves using a catheter attached to two different syringes that are filled with fibrinogen and thrombin, which are injected together to fill the channel that the fistula created. The contents of the syringes combine and form a clot that seals the fistula. Others can have aceton inserted, and aceton is a name given for a special surgical thread that is made of inert material which can be inserted into the fistula that helps in draining away the pus. Then you can have a ligation of intersphincteric fistula tract, or better known as a lift procedure. This procedure is designed to close complex fistulas without damaging the internal and external anal sphincters. The intersphincteric space is the space between the internal and external sphincter muscles in the rectum, and the lift procedure involves making an incision in the space that goes down the fistula tract. The fistula is then cleaned before being closed up. A fistulotomy is a procedure where the entire length of the fistula is surgically cut open from its internal to external site using a technique known as a laying opening to open it up and allow it to heal. And then lastly, you can have a fistula plug. This is an inert plug that is inserted at the site of the fistula. It acts as a foundation for cells to grow on and seal the site of the fistula, allowing it to heal. So to summarize, we've looked at the many different operations that can be done when having IBD. So we've looked at why surgery may be needed in IBD and the different types of operations that can be done to manage it.